Good day to you all, and thank you for taking time out of your schedules to join us in our discussion of boosting your immunity through hormone optimization. My name is Kevin Sullivan, and I am the San Diego Territory Manager for BioTE Medical. I am very excited to have Dr. Michael Woo-Ming with us today. Michael, how are you?
Great, thanks, Kevin.
So, as I said, I have the pleasure of working with Dr. Woo-Ming for the past year, and I'm very excited to have him here with us today. He will be discussing with us immune boosting strategies through bioidentical hormone replacement therapy through BioTE Medical, and bringing clarity on how to care for yourselves in these interesting times. So real quick, let's go over the agenda. We're going to be talking about our current commitment and recommendations. We're going to be talking about immune boosting strategies. We're going to talk about hormones itself. We're going to talk about bioidentical hormone pellet therapy through BioTE. We're going to talk about the thyroid and introduce that. And then we're going to talk about nutraceuticals and ways we can help optimize your system. And then at the same time, we're going to talk about next steps and a call to action. And also, we want to discuss an FTC disclaimer. So that being said, I wanted to, before we get started, just do a little bit of background on Dr. Mike himself. Dr. Michael Woo-Ming, MD, is the owner and founder of Executive Medical in San Marcos, California. He's been providing quality care to thousands of patients in the North County of San Diego since 1999. He's a graduate of the Mayo Clinic Family Medicine Residency, and his interest in bridging the gap between allopathic medicine and integrative medicine has led to the establishment of Executive Medical. He oversees the direction of a number of weight loss and wellness clinics in Southern California, and his writings have been featured in Physicians Practice and Medical Economics. Dr. Woo-Ming has a strong business acumen and is regularly asked to speak on marketing and business topics for other physicians and entrepreneurs. Dr. Mike is educated in providing quality bioidentical hormone treatments as a certified BioTE physician, as well as providing quality occupational medicine and veteran disability evaluation services. He is undoubtedly passionate and dedicated to improving the health and well-being of each patient through innovative, evidence-based medicine, and most importantly, personal care. He is definitely one of our best. So please grab a notebook and a pen and something cold to drink. And without further ado, Dr. Mike, take the floor.
Thanks, Kevin. Thanks, guys, for everybody joining us on this webinar. I really appreciate you taking your time out of your busy schedule to join us. I'm going to try to keep this relatively short, but we will have time for questions at the end if you have any of those. I did want to let you know that what we're going to be talking about is immunity and boosting your immunity through hormones. I do want to give a quick disclaimer, FTC disclaimer. Of course, anytime it has to do with your health, you have to do your own due diligence. The FTC right now has not given any recommendations in terms of any type of treatments. There is no vaccine that's been developed at the time of this recording, but there's been a lot of studies that have been taking place, both here in America and internationally as well. But what I'm going to be talking about are things that I've known with my own patients, things that have been working in our own clinic. But as I mentioned at the beginning, you need to do your own due diligence for your family. The reason that we decided to do this talk today is because I got all these questions about, obviously, we're all concerned about COVID-19. How can we best protect ourselves? We know about all of the things that we're supposed to be doing, but is there anything additional that we can get, especially in this time of uncertainty? So that's what we're going to be talking about, with an emphasis on bioidentical hormones. And Kevin, it looks like I'm having trouble with the slides. So if you wouldn't mind just taking control of that.
Yes.
Back? Yeah.
Okay.
Sorry for the little technical difficulties, but everybody is using Zoom these days. So if you wouldn't mind hitting the first slide, that'd be great.
You bet. Okay.
All right. Okay, so as I mentioned, we all know about the things that we need to be doing with COVID-19. We all know about staying at home. wearing masks, washing our hands, practicing social distancing. That's going to help. We talked about flattening the curve that we all heard about. But what can you do today that can help keep you and your family happy and healthy? And where it comes is having a protective armor, and that is boosting your immune systems. And that's what we're going to be talking about today. Next slide. Okay, so people ask, what can I be doing right now that can improve my health? Pretty much universal. It's not a rocket science. It's getting a healthy night's sleep. How many of us actually do get the recommended 8 hours of sleep? Pretty much very little of us do, right? But we know that even 6 to 7 to 8 hours can have a tremendous effect on your immune system. What can we do to improve our sleep? We all know about the different sleep aids that are out there. At Executive Medical, we recommend natural treatments. I'm a big proponent of melatonin, CBD, if that is something that you could be taking, are great options for that. Obviously, you want to avoid activities that can interfere with sleep. No alcohol, just prior to it. In general, it's recommended, in the evening time if you can. Try not to eat, at least 3 hours, within 3 hours of going to sleep. Having a sleep routine, I've recommended even having a sleep journal, so you can recommend, when you're going to bed, what time are you waking up? I'm a big Starbucks fan. It's well known. Kevin knows about this as well. I knew my caffeine, but it is recommended to reduce the amount of caffeine. I encourage everyone to, if a caffeine is a part of your life, try to resist doing it afternoon. Even an afternoon, cup of coffee, or one of those 5-hour energy drinks that can actually do tremendous damage to your sleep cycle. So those are the things that you want to recommend. There has been, we know now that we aren't getting our sleep. We know that anxiety and sleep are intertwined. We're all a bit more anxious, all a bit more stressful now these times. Cognitive behavioral therapy, there are apps that are now involved where it can help with meditation, those kinds of things. So those are some things that you can think about. Again, not at the time of this call, but some things that you can actually, to strive for. So getting a healthy night's sleep is really important. Next slide. Again, we said it's intertwined, reducing stress. We all know, again, we're all quarantined, we're all anxious and depressed. What can we do, ways to reduce these amounts of stress? So some things that you can do that is universal. I'm a big proponent of meditation. If it's prayer is what you do, that's great. Spirituality, whatever works for you, whatever you believe in, having some quiet time. I like to do it, in the morning. I'm usually an early mornings, an early morning person. I get up about 5 or 5:30, even 5 or 10 minutes of just some type of quiet time. There are things that you can download. There are apps that do meditation apps. There are guided meditations that you can watch or listen to on YouTube. There are apps, I'm not going to give you one specific app, but one that's very common is called Calm. That's available especially if you're a Kaiser person, you get that free. There are online yoga classes that you can take. Anything where you're taking time for yourself. Again, for myself, one of the reasons I did it is that, I've got 2 kids and now adults now, but when they were younger, 5 to 6 in the morning was like the only time that I actually had of some quiet time. If you can get outdoors, what's outdoors? What is that? Those things out there that are called trees, those things with those things that are falling, those are leaves. Get some fresh air. If you can do it every day, don't just kind of keep it up. We do know that, that COVID-19, it likes indoor things, right? It likes things indoor. Try to get outdoors. Take a walk. Obviously you want to do your social distancing, wearing masks when appropriate, but try to get some fresh air. Start a gratitude journal. That's one thing that I teach my kids who are now adults, is to have some type of gratitude. I taught them at an early age. I said, can you think of 1 to 3 things that you have gratitude for? I mean, how many of us actually do that? Just think of the things that we have. I mean, I've traveled to third world countries, from an immigrant family. My parents came from very impoverished areas, and even things, like running water or having a flushing toilet, things that we take for granted. But how many things that we have for granted that, it just kind of humbles us. So if you can think of 1 to 3 things, my ability to actually talk to you on this camera using the internet, be thankful for the internet. These days, we're a very polarized society. We've all got, one or another, who we're rooting for, who we're rooting against, and it just leads to more stress, So I discontinue viewing news. I tell my wife that. She's like a political junkie. I said, yeah, turn off that stuff. Keep yourself educated. But, the social media, I know, Kevin, you're a big, Instagram. You love doing Instagram and TikTok and all those kinds of things, big of that. They all have its place. They can be fun. But, it's also times where you kind of comparing yourself to some type of person who's living the luxury life, and you trying to aspire to that. I see that with my kids. But what's happened is a lot of us, as a father, I'm seeing it with this comparing with one another and trying to live that ideal life. It's not good for the soul. So if you can, at least if you can't turn it off, at least minimizing it. Those are all things that are common sense, probably what you didn't expect to hear on a call from a doctor, but these are things that have real life applications that I wanted to share with you guys today. So have a little bit, I think we had a little bit more gratitude, the world would be a better place. Kevin, next slide. Okay, I think we missed one a little bit. That's okay. So what we're talking about is balancing your hormones using BioTE. What is BioTE? We'll get on it. If you're, many of my patients already know what it is. It's a company that is focused on optimizing your hormones. And I was one of the first doctors to actually bring it to San Diego County, if not the first, at least the first in North County to that. So I'm a big proponent of it. But we're going to talk about why it's important in balancing your hormones to help prevent things like COVID-19 to really boost our immune system. Next slide. So let's talk about hormones. Hormones, sometimes that the concept might be a bit difficult. We've all heard about it. We've heard of hormones that can cause like road rage, or hormones because we're more sexually active, those kinds of things. You see that in society. One way to kind of think of it, it's almost like a text message, but these are chemical text messages, and we're texting our organs. So we have these different hormones in our body that are sending signals to our different organs that help regulate us, that help keep our temperatures warm and cool, that help us, regulate our body. And the way that hormones work, it works in a lock and key fashion. So if you can think about it, is if the message is the key, the lock are the receptors on these organs. So if you're able to have a key that kind of looks like our own biochemical process, we can unlock our organ and have it to function appropriately. And that's what we're going to be talking about, how with BioTE, we use bioidentical or biologically identical hormones that are almost mimic the molecular structure of our body and telling our glands, our cells and organs what to do. And we'll talk about why that's important and why that can be an effective way for you to maintain and optimize your health. Next slide. So we talk about our hormones, and when everything is working well, everything is aligned. You don't hear a lot about people talking about hormones a lot, when they're kids or even when they're young adults. Where do you hear about out of balance hormones? Well, I know in my own practice, where we hear a lot about is when we get to a certain age where our hormones get out of balance, and we'll talk about why that happens. But everybody is a bit different, but generally in our late 30s or 40s, we find out that the things that we were used to do, we're not as good as, or we're not as capable as we used to. So I'm going to give you some of these symptoms, and you can let me know if these sound familiar. So things like having an extreme fatigue. If you work throughout the day, if you're working for somebody else, or if you're even staying at home, we have that many of us hit that 3 to 4 or 5 p.m. where we kind of hit a wall and we want to sleep, right? We've got mood swings, we've got anxiety, irritability. We talked about insomnia or lack of sleep. If you ever find yourself waking up 3 or 4 in the morning, is this psychological or is there something physiological that might be going on? Do you feel that you've got memory issues, forgetfulness, depressed mood, lack of focus, lack of drive, also known as brain fog, hot flashes, night sweats, weight gain, joint pain? One that I don't have here is some of my patients are what we call weekend warrior types. You know, they may have been athletes, college athletes. Kevin, he used to play some pro ball or semi-pro ball. That's one of the reasons. We can talk about a little about that, but how he got involved with BioTE. But, you know, workouts aren't as good as when he was in his 20s or 30s. Migraine headaches, decreased sex drive or sex performance, elevated blood pressure. And to let you know where I come from, I came from a pretty conservative, conventional training. I went to the Mayo Clinic. It's well-renowned. It's great, but it's also very conservative. It's great, you know, great training. I wouldn't question it. You know, I truly am glad that I went there. But sometimes when you have conservative treatment, it ends up kind of treating the symptoms rather than getting to the root of the problem. And since I've been, you know, studying and teaching hormone replacement, I realized that a lot of these things are out of balance that are causing this. So sure, you could have a treatment for every one of these things, but are you truly getting to the root of the problem? And that's what we're going to be talking about today. Next slide. So when you have optimal hormones, when you're able to have optimal hormones, what can happen is many of those symptoms that we just discussed, they can be improved. So what were we talking about? An improving feeling of overall well-being. Your depression is diminished, improved sleep. Remember I said that was important in helping to prevent, you know, your stress, decrease anxiety, decrease stress, decrease fatigue. What does that all include? What you're doing is you're improving your immune system. We all know this, right? You know, it doesn't have to be COVID-19. When do we get colds? We get colds and, you know, symptoms because oftentimes we're stressed out, you know, maybe, you know, during the holiday rush, we're trying to get things done, you know, at the end of the year. We are working ourselves, we're not getting enough sleep. And often those are just like prime, like, yeah, those viruses are like, yeah, I'm ready to go because our immune system are diminished. We know that in the hospital setting, right? Many times we are ill. You hear things about why did this person pass away from pneumonia? It's because their immune system wasn't strong enough. You know, they died from viruses because their immune system wasn't strong. Where a pneumonia, let's say in a 22-year-old, you know, healthy young adult, they might have a pneumonia, yeah, maybe a week or two. But how does that same pneumonia cause someone to pass away in the hospital? It's because their immune system wasn't strong enough. So if there's one thing that I want you to get out of this is to focus on what can you do every day that can improve your immunity system. We already talked about sleep. We already talked about reducing stress. I didn't talk about too much, but obviously exercise is important, you know, for cardiovascular sense, but it all contributes to immunity system. What if you've done all of those things? Or what if you know you can improve other things? Are there things that you could do even more? And that's where something like BioTE might be helpful to you, is when we talk about hormone optimization. So what is the BioTE method? The BioTE method focuses on balancing several different hormones. You know, it's surprising when I have been working with BioTE for several years, and they'll come in talking about hormone imbalance, and then they'll find out like, wow, I really had this thyroid issue, and I didn't know you guys even work with that. Well, the important part, and one of the reasons why I work with this company, is they focus on all hormone optimization. So we're going to talk about how thyroid can play a component to it, testosterone, estrogen, and progesterone in females. We're also going to be talking about how some nutraceuticals, perhaps, you know, you might not be a candidate for BioTE, but maybe there's some things that you could be doing to improve the results, and then we're going to talk about that here today. So let's talk about thyroid. So first off, what is your thyroid here? You know, it's a thing on your neck, that little gland here that I'm sure you're familiar with. Well, the way that they describe thyroid, it's not exactly 100%, but it's oftentimes, for my own patients, they understand it. I like to think of thyroid almost synonymous with metabolism. If you have a low functioning thyroid, think about low metabolism. What are the things you think of in your head? You know, you're sluggish. Maybe you're cold. You get cold easily. Those are function. You more likely to gain weight because your thyroid isn't functioning. If it's higher, you know, you're able to lose weight. We've even seen sometimes where it gets too high, right? If you have a too high thyroid, you know, you're often thinner or your heart starts racing. And that's, most people kind of think of that, you know, thyroid can regulate metabolism, but it can also regulate brain function, temperature, energy, and of course, immunity, what we're talking about. Now, here's the thing, since I've been with bioidentical hormones, you know, the way that I was tested, and majority of doctors were tested, is when we look at thyroid, what do we usually look at? Generally, we're looking at some type of lab value. So how many of you have been to the doctor? Maybe you've asked about your thyroid. Maybe you've noticed you've been gaining some weight and you've done everything you can. And then you kind of get disheartened because your doctor says, well, your thyroid, it's normal. Again, I'm not going to say it's 100%, but most of the time they're just looking at a lab value that's called the TSH. And that's how I was tested. If it was within normal limits, your thyroid is normal. Since I've been, you know, studying hormones all these years and working with BioTE, I know that is not entirely true. There are other lab values. Often these are lab values that your doctor isn't checking for, that we check at our clinic and other BioTE providers are checking, that look at the actual thyroid and how that's working in the body. Like I said, they check a lab called TSH. We look at TSH, we also look at something called T3 and T4. And these are things that where we're actually seeing what is the thyroid actually doing in the biochemical level, how is it actually working? And if we can optimize your thyroid, that can go to a long way of helping improve your immunity. And did you know that over 30% of people have a hypothyroid, a low functioning thyroid? Again, one of the things that I try to talk about personal things, and anybody who's been with me know that my first patient using bioidentical hormones was my wife. And I'll talk about her story a little bit later, but she did not know that she had a low functioning thyroid. And she was very despondent. She'd be working out like a beast and things weren't working. And we actually found that she had something which is known as Hashimoto's. And we were able to now use medications, the appropriate medications to find it. But her doctor, unfortunately, told her she didn't have a thyroid problem. And it wasn't really until understanding this and studying this and working with the fine folks at BioTE that I understand that, yeah, this is a big problem that a lot of people don't really know about. Next slide. So what are some symptoms of a low thyroid? We talked about cold hand and cold feet, dry skin, weight gain we talked about. You may have irregular heavy periods. I love this picture with the coffee cup on there. Thinning hair, brittle nails, abnormal heart rate, depressed mood, impaired memory. If any of those things sound familiar, and if your doctor said, your thyroid's normal, you may want to look at it in again. And that's something we offer at Executive Medical. We can check your labs, get the appropriate labs to see if this is the case for you. What are ways that you can treat thyroid? Well, just as we said about getting the right labs, we also give you the right thyroid medication. And the thyroid that we like is natural thyroid, and Nature Thyroid just is one of the brands that we use. And what natural thyroid is known as desiccated thyroid. Did you know that the thyroid that they give these days is from synthetic thyroid? Now, synthetic thyroid has been around maybe for about 30 years, but natural thyroid has been around for over 100 years, guys. So we got a lot of information over those 100 years. And you don't have to take my word for it. If you follow thyroid, if you've worked with thyroid patients or know someone with thyroid, oftentimes it can be very difficult with synthetic thyroid. Again, what I'm saying, my endocrinologist friends are not going to be very happy with me saying this. And again, you need to do your own due diligence. But since I have been doing this for quite a while, natural thyroid seems to be the way to go. And that's something that we offer here at a BioTE. Now, and an Executive Medical. It's also important that you can be supplemented with iodine. You know, a lot of people are like, well, why are you talking about iodine? Well, with iodine is one of the building blocks for thyroid and have the thyroid to work effectively. And we don't get enough iodine in our diet. unless you eat iodized salt. I don't know, Kevin, do you eat a lot of iodized salt or a lot of seaweed or those kinds of things? You're probably not getting a lot of iodine, and we know that in our body. And just a little spoiler alert, iodine may have a significant impact on what might be going on with COVID-19. So you just want to pay attention to that, and we'll talk about it a little bit later. But another thing that you might not know about is we talked about something really quickly, something known as Hashimoto's disease, which is a sign of thyroid abnormalities. Did you know that having a gluten-free diet can help with that? So that's why it's important to know what your thyroid function is. So you want to ask the questions, with your provider is what are they actually checking when they're looking at your thyroid? Some things that you want to take a look at, T3, T4, in addition to TSH, at a minimum, guys. So, okay, so we talked about thyroid. Thyroid is something that you take orally. Now let's talk about testosterone. Now, this is what I want to talk about some myths or some things that often people think about testosterone. Next slide, Kevin. So testosterone, most people think, oh, that's just a man's hormone. Well, it's present in both men and women. Men have it more than women, but in both, it kind of peaks in our 20s, and as we get older, it diminishes. So as it says here, men will lose 1 to 3% of production, women will lose 1 to 50% of that. So why should you care about testosterone? Well, we found out that a lot of the symptoms that we showed you earlier, the mood swings, the ability to recover from working out, mind issues, brain fog, those kinds of things, often it's because it's in our 20s. How many of you, maybe you don't have to raise your hand or anything, maybe you're in your 40s and 50s and I just can't eat the same as I can in my 20s and 30s, right? Gosh, when I was a teen, I look at my kids, my son is 20, my son is 22. My son can eat anything, and you don't see it. Maybe now you're seeing a little bit, but he'd eat everything, just like, oh my gosh, this all you can eat place is going to kick you out because you eat too much. And then you find out you can't do the same thing in your 40s and 50s, right? Well, that's because back then, one of the reasons is because our testosterone was optimized. But as we get to our 20s, we can't seem to do, eat as much as we could. I see this with our patients. We also do weight loss, medical weight loss in our clinic. And especially in our men and women in our 40s and 50s, they've done everything right, done everything they can, but they can't seem to lose those 5 or 10 pounds, and it can get very frustrating. Oftentimes, it's entirely due to their diet. It could be due to their hormones. So that's often what we check. We check it with a simple blood panel that looks at your testosterone. And if we can optimize your testosterone, it can help them. Now, I'm not saying you can eat whatever you want if your testosterone is great, but it can help prime the pump. It can help keep your body with the ability to lose weight a little easier than you can if you didn't have your testosterone optimized. And optimal testosterone helps with protection of bone, brain, breast, and heart, and relationships. That's a big deal too. And I've actually been invited to weddings because I help their relationships with having optimized hormones. But that's a story for another day. I presented the slide to you because I wanted to give you guys like the cutting edge information. And again, you've got to do your due diligence. But if you've been focusing on what's going on, when I look at the news, I'm focusing what's the science, what's going on, where are we getting closer to actually finding a solution to this, right? What they're seeing now, in COVID-19, coronavirus, that men die more than women. The amount of deaths, percentage of deaths for men are much more than women. Here's what they're looking at. They're looking at hormones. One thing they're looking at is testosterone. We know that men are dying more than women. What they've also known, in terms of COVID-19, people who've died from COVID-19, they're finding a statistically significant relationship that people who die are more likely to have lower testosterone levels. So just let that sink in a level about why I'm a big proponent of this. Again, you need to do due diligence, but this was just taken maybe about a month or so ago. And so they're doing studies right now, but this is another indication that optimizing testosterone is going to play an even more important role moving forward. So what are the benefits of it? What we do with bioidentical hormones, if we were able to replace the testosterone using safe and effective bioidentical hormone for both men and women, here are the things that can help with. Ability to lose weight and body fat, get more energy. That's probably one of the first thing that I've been seeing. Feeling like your best self again, improvement, relief on anxiety, depression, improving mental clarity, getting rid of that brain fog we talked about, memory, focus, best night's sleep in years, enhanced sex drive. To be honest, guys, this is one of the first things I see. I talked about getting, jokingly saying being invited to marriages, but there's some times that, it's actually saved marriage, as sex can be a component to that, an important component to a healthy marriage. Enhanced performance, breast and prostate protection, brain and heart protection, building bone mass. Gosh, I see some of my patients when I was doing primary care, and they have a hip replacement, and I could tell you, when you have a hip replacement, unfortunately, the percentage chance of mortality increases significantly if we can build that bone mass, in ways other than just calcium supplementation. That's going to be very important moving forward as we get older, increasing muscle strength, lowering cholesterol, all the benefits from that. Now we're going to talk about estrogen. Now, again, just like we said with testosterone, most people think, oh, estrogen, that's a female hormone. Well, next slide, Kevin. Estrogen is seen both in men and women. It's not about the amount, but yes, women have it more, but it has over 400 functions that can effectively control in the body. Most people think of estrogen when they're going into menopause. They're thinking about symptoms such as hot flashes. But I have had patients who never had hot flashes, but they have the improvement from things you can't measure. Maintaining bone density, help maintaining your memory. We've seen oftentimes in our skin, right? That dry skin, that crinkly, paper thin skin. Oftentimes it's because collagen isn't being maintained, which estrogen is an important part of. And then remember I talked about that happy person. Those are those happy hormones in estrogen because it increases serotonin and dopamine levels in the brain that estrogen helps become a part of and maintain. Let's talk about hormone levels. Now, what we're talking about in terms of bioidentical hormones, you may have heard of other ways that you can have hormone replacement. Now, I'm going to give a little bit of a history lesson. So, for those of you who are not a big fan of history, I'll kind of make it important and entertaining for some part of it. I've been in practice 20 plus years. Now, when women would have hormone, quote, issues, they would have menopause, they're having hot flashes, night sweat, we would give them hormone replacement. The most common one was known as Premarin. Well, Premarin is actually, and sorry, we're doing this call at the time during lunchtime, so I don't want to lose your lunch here. But Premarin, if you may or may not know, it's made from horse urine estrogen. Okay, it's taken from horse urine. Okay, that's what we would give them, and just as we said, by replacing the hormones, it would be beneficial, and they improved. Then a study came out called the Women's Health Initiative, came out in the early 2000s, which found that maybe this isn't the most safest way that we should be giving hormones. Hormones related to things like breast cancer. Oftentimes when people come to me, can this cause cancer? Well, they're thinking about the synthetic hormones, those type of hormones that were done in the past, and they were unfortunately associated with these kinds of things, meaning small percentage, cardiac abnormality, those kinds of things. Now, here's what happened. Once that study came out, basically doctors were saying, hey, stop prescribing that stuff. In fact, some of us were saying, let's not even talk about it anymore. Okay? Does that mean the problems went away? No, it didn't. Women, of course, and men were complaining of these same symptoms, and they didn't have anywhere to go. And that's where bioidentical hormones came about. So bioidentical hormones have been around for quite a while. The most common were creams. Some of them were patches, or some of them were compounded, formulas. And the thing about it is they were bioidentical or biologically identical to those type of hormones in the past without all of the dangers that we just mentioned, but they were biologically identical. You remember earlier I was talking about the key and lock, where we're having a key that fits into the lock? Well, that's what these biologically identical hormones are doing. They're having the same molecular structure, but they're able to fit in and send that message and tell the organs what we want them to do. Now, so bioidentical hormones were it was an opportunity, but unfortunately, just like as in anything, the medical establishment is a little bit too late to the party, so these kind of things. So oftentimes, we were giving this with compound pharmacies, and we're still learning these kinds of things. So we were trying orals, we were trying, patches. The issue here with the creams was probably one of the first ones that were being used. And creams can be effective, but the problem is it's up and down. It's up and down. And if you're watching this from here, we're in Southern California, it's the summertime. Imagine putting a cream on the same time of day and the same amount. Pretty hard to do. In fact, I had a patient who came in with a folder full of times where she would write down the creams when she was putting it on and off. And she wasn't getting the relief that she had. And with bioidentical hormone pellets, what it does is it's almost set and forget. So what it involves is we check your blood work, determine where your hormone levels are at, and then based upon that, we have all of this data. See, I'm one of probably, 2,000 plus, 3,000 plus doctors who do this around the country. And because of this, we have all this information. And then we'll know based upon your information, your age, whether you've had a hysterectomy, whether you were prone to acne, whether you're a smoker. We take all these into consideration. You get your blood work, and once we get it back, it tells us how many pellets that we need. And I'll talk about what pellets is and what that involves in just a few minutes. But it's implanted, and what that gives you is, as you can see in this graph, that almost steady stream of, not getting these ups and downs, but just gradual, a steady state. And that's what you want. You don't want something that you're going to be having to remember, to put on, whether you're sweating and it rubs off. You don't want anything like that. If you really want something that's almost set and forget, this is why I was a big believer in pellets. And as a matter of fact, some patients come to me and say, can I put you on creams? And my goal is to give you what I feel is the best for you and the safest for you. And that's going to be not only that, but actually cost effective for you. Imagine how many times they use these creams, and half the time or quarter of the time, it's not being as effective as it can. And that's what bioidentical hormone pellets can do. So benefits from just estrogen, eliminating hot flashes. We talked about skin. We talked about increasing those happy hormones. Helping maintain memory, helping prevent dementia. That's a big component in my own wife's family. Her grandmother, unfortunately, had Alzheimer's. So that's a big component about why I had her as one of the first patient I had, because we were concerned about those kinds of things. Again, I'm going to move on, but you can see there's significant benefit by doing this. So let's talk about the pellet therapy method. So the best way that I can describe it is, again, why I decided to use bioidentical hormone pellets and why I decided to work with BioTE. There are some other pellet companies. BioTE is the biggest, and in my biases is the best. When we were first using pellets, when we were first doing it, some of these companies were starting this out, and it was almost trial and error. In my opinion, BioTE, and again, through the satisfaction of my patients, is the biggest, and we actually use science to back up everything that we say here. But I wanted to share with you just a personal anecdote of why I got involved. As I mentioned, I came from a very conservative medical training. Mayo Clinic, I believe, is one of the best, and I worked in primary care. But my wife, who was a special needs teacher, stay-at-home, and then became a stay-at-home mom. In our early 40s, she was having really bad troubles with migraine headaches. A lot of hot flashes, a lot of mood swings. I know it wasn't 100% my fault. Maybe it could be, I don't know. But the problem is she went to her doctor, who was trained at one of these conventional institutions. Again, I'm not going to give you any names, but they said, you know what, I think it's psychological. And they put her on antidepressants, and they put her on anti-anxiety medications. And yes, that could be a component to it. I'm not trying to say that the doctor was doing anything wrong, but that's how he was trained. Remember, we weren't even allowed to talk about bioidentical hormones, okay? So I actually sought out for it. And I sought out this company, BioTE, and I looked at the others. I went with one that I felt had science behind me, had the amount of doctors who were understood the literature, understand what's going on, and that's why I went with them. And that's why I want you to do your due diligence as well. And she was my first patient. So what involved is we checked her blood work. We found out that she was had abnormal levels of very low levels of testosterone, and I pelleted her. I got trained to do it. Got the right to become certified and to do this. I was the first in North County, I believe, and she was my first patient, and it changed our whole lives. Her migraine headaches, I'd be lying to you if they completely went away, but it went from like 5 times a week to like once a month. Now it's maybe once every quarter. That might be due to me. But in terms of her hot flashes, we would have a special bedspread just for her for the hot flashes. That went away. All the things that we've talked about improved, and she continues to be on hormone pellets to this day. And the thing about pellets, it doesn't last forever. On average for women, it's about 4 months, and I could definitely know when it does go away, and we have to get pelleted again. But it has changed our lives. I've been pelleted. It's changed my life. I don't mean to share this, but now Kevin's been pelleted as well. And it's allowed us to cope. And I feel that we have a stronger protection in terms of our immunity. But let me tell you about the therapy itself. We get your blood work. And then once it's done, we check at your levels. And then based upon your blood work, it determines whether or not you're a candidate or not. And if it is a candidate and you decide to move forward, we schedule you for the simple office procedure. Basically, based upon this, you either need testosterone and or estrogen, depending on where you're at. For women, for men, it's just testosterone. And it's a simple office procedure. We make a small incision in the buttock/hip area. It's such a small incision, I don't even need to put in a stitch. Of course, it's all numb, anesthetized locally. Your pellets are all sealed at the time of the procedure. We open them up. We use a special instrument that pushes them in under the skin, and then that instrument is removed. In terms of downtime, there's really not a lot to talk about. Just kind of common sense for women. For the next 72 hours, we don't want you swimming in the ocean or sitting in a hot tub, or we don't want you doing any leg exercises, just common sense stuff. Thinking we don't want to cause an infection, those kinds of things. For men, it's a little bit longer, a week, just because we have to do more pellets. And that's about it. And I can't tell you it helps right away. Generally, you find improvement within 1 to 3 weeks. 1 to 3 weeks. We check blood work in about 6 weeks for women, 4 weeks for men. And that determines how fast you're going through the pellets. Like I said, I wish I could tell you it lasts forever. It doesn't. For women, it's about 4 months. For men, it's about 5 to 6 months. But basically, I've had patients with me since we've opened. For many of them, it's been a significant change in benefit. My practice grew. We don't do a lot of marketing for us. I have help with Kevin and such because I really didn't need to do a lot of marketing. It often was just word of mouth, which I feel is the best way to market something. Sisters telling sisters, girlfriends telling girlfriends, sisters telling moms, guys telling other guys. Although guys, we don't like to talk about our health too much, but in general, that's how our practice has grown. And again, it just is a simple procedure. The first step is just taking a simple blood test. So what are the hormones made out of? As I mentioned, these are plant-derived, generally from soy or yams. It's all natural. It's not being created in synthesized chemically. They last. We talk about how long they last. Hormone replacement. This has been the most widely studied form of it. It provides a steady level. Again, each person is different. Unlike some of those other companies, I can tell you, they don't use the science. I can say, we base it upon your lab work, based upon your indications, and it's implanted under your skin. And it really is almost like a set and forget. You don't even know it's there. And again, I apologize for guys for going a little bit over. I get a little bit passionate about this, but if you can kind of stay on, I tell you, it'll be worth your wait. The method in general is safe and evidence biased. It's clinically effective. There's over 3,000 of us plus the doctors who do this around the country. Low side effect profile. I've had some people one thing that's important too with being with a company like BioTE, I've had some patients who've moved, let's say to Texas. I'm not sure why you would, but they moved to Texas. You can find a BioTE provider who will take care of you, from that. So that's often, you don't see that often. And it's important that you make sure you get that continuity of care. It helps with protective breast, bones, brain, heart, and relationships as well. Just a note about nutraceuticals and why it's important. I didn't want to focus, of course, on hormone therapy because that's the biggest question that I get. But there are some things that you can do. Perhaps you're a bit younger, watching or listening to this, and maybe you're not at an area, maybe your testosterone is great. Are there things that you could be doing? So I want to share with you things that I've learned and things that I'm reading in the literature that have been effective for me. Next one, and our patients. So this is fresh off the press, guys. This is actually a study that is coming out in November, but this is one from the author for finding iodine. So there was interesting thing that I was reading where people were actually, some of the frontline providers in some of these countries, as a way of prevention, they were actually taking like iodine liquid and actually gargling with it, to prevent for COVID-19. Now, why were they doing this? And just think about that, you may have seen these iodine bottles. I don't want you doing that. I'm not advocating doing that, but that's what they were doing. Well, what they found out is that iodine may be a preventative, and I dare say, I'm not going to use the word, but this is what they said, curative agent. Again, that is their words, not mine, in COVID-19. Iodine is something that is pretty inexpensive, that is, very safe to take, that we could be doing. I talk about the importance of iodine. We don't get it in our diet. Can we be taking iodine? Well, we're suggesting that iodine is an important supplement moving forward. And because it is safe, it is inexpensive, it's something that I've been mentioning to my patients. Next slide. So how does iodine work and how might it do it? Well, what has been shown is when they were giving patients iodine, it was actually reducing the severity of the respiratory illness. And we know that in COVID, obviously it's always the lungs, right? They found that with iodine, as along with zinc, it helps prevent their viral replication in cells. And as I mentioned in the past, earlier in the slides, we talked about iodine is important for thyroid function. So that's one thing that you want to consider. Iodine, along with selenium and zinc, may be an important component that you should be considering taking as a supplement. I recommend iodine. We have it here in our clinic as a very safe and inexpensive way to help boost your immunity system. ADK, I always advocate a multivitamin. One in particular that's important for my hormone therapy patients is vitamin A, D, and K. We all know about vitamin D, with oftentimes the best way is to get it from the sun, but since we're all kind of quarantined here, our vitamin D levels are dropping, and that makes us more prone to infection. Along with other benefits that vitamin D can do, it helps maintain muscle and bone, diminishes cancer, diminishes cardiovascular abnormalities, it helps with improving our hair and nails. And A, D, and K is something that we do in conjunction because all of those can help maintain our immunity system. And again, that's a supplement. So whether or not you get it from us, make sure that your multivitamin has enough A, D, and K. I can tell you a lot of them don't have enough of those types of things. You end up taking like bottles of that kind of stuff. And one joke that my doctor mentor told me is that, Americans, we have expensive urine because we take a lot of these kind of supplements. Well, I don't want you to be wasting a lot of time taking a lot of spending a lot of money on supplements that you're essentially just urinating yourself out. But vitamin A, D, and K is one that's really important for you, not only improving your immune system, but all of the benefits that I mentioned here. DIM, what is DIM? This is something that we make mandatory for all of our hormone replacements just because it's so great in maintaining your hormones. It improves the absorption. I feel it makes the pellets last longer. It balances out estrogen in men and women. It helps with, for men, testosterone. You may hear in synthetic testosterone, you might have some shrinkage of testicles. Well, DIM helps lessen or it reduces percentage of that. It also has benefits in terms of reducing estrogen-related issues like migraine and premenstrual syndrome and acne, which can be prevalent sometimes. Probiotics, again, just a word on that. We all know about gut health. We all know that these days, whether it be environmental, whether it be chemical, we don't know, but we're just not absorbing what we should be absorbing. We all know probably with processed foods, I think that plays a role to it, environmental issues, who knows, but we're just not absorbing it. That's one of the reasons in our clinic we do IV therapy, because you're getting it straight through it. You're not having that to fight through your stomach because you're not absorbing. But one way that you can do it is through probiotics, and that's why it's important that we have gut health. Again, another strong component. I don't really have time to go through everything with that, but it has shown that probiotics reduce respiratory infection, many of which are caused by viruses. Obviously, COVID-19 are just one of those types of viruses. Just to kind of sum up for you, what are the things that you could be doing now? Talk about getting a minimum of sleep. Didn't want to talk too much about exercise. If you can get your heart rate and it's safe, you want to do some type of exercise. They recommend 150 minutes a week, so that could be 5 days, 30 minutes a week. It could be 3 days, 50 minutes. If you do an average 150 minutes, it helps improve your immunity, and of course, all the other benefits that exercise can provide. We talked about using apps, having a gratitude journal, getting out and seeing nature. So what are some supplements that you could be taking? I mentioned things about iodine. I'm a big proponent of iodine. Didn't have a chance to mention about vitamin C. There's still some controversy, to that, but vitamin C can be helpful and may be helpful to that. Again, do your due diligence. I recommend ADK for you to take. DIM, as I mentioned, even if you're not a hormone, anybody can benefit from DIM in terms of hormone balancing. One thing that I did want to mention is we offer IV therapy. We have one in particular drip that's really popular called the immunity drip. It helps replace a lot of the minerals that we're not getting because we're not absorbing it through the gut, that we also offer into our clinic. You can call us or go on our website and you can find out all of our different IV therapies. Well, just some things too. I know that some who are on the call are patients of us, and because of COVID-19, we did have to, just as many clinics had to do, we didn't completely close, but we had to reduce our hours, and we're still in reduced hours. I do want to reiterate that we all are, of course, doing safety precautions in our clinic. We spend a lot of time, not just money and energy, making sure that you're safe when you come to our clinic. Every one of you has to come in with a mask. We're all gloved. We use hand sanitizer. We use social distancing. We don't have more than one person in the waiting room. Unfortunately, at this time, we can't have a lot of guests coming in there. So you want to be aware of that. We can make accommodations. If you want your spouse here, please let us know before it so we can make the accommodation. It's just being safe. We all want to get out of it. If we all kind of play our role, play our part of it, we're just letting you know we're doing our part. So if you're someone who is, I want to get back in, but I'm still, and honestly, still not sure whether or not go out, we are doing safety precautions. Feel free to talk to us if you have any concerns. We can go through our protocol with you, what we're doing. But we want to see you back, because I know for some of you, it's been, at the time of this recording, it's been a few months. We haven't seen you, and I know that you're probably due for some pellets, and you probably are feeling it as well. Give us a call. Our phone number, 760-290-3552. We'll be happy to see you. And with that, I think we're good.
Yeah. Well, thank you so much, Dr. Mike. That was, gosh, what a great presentation, great information, and like I said, a good call to action for all of us. And, before we wrap up, I want to open up for some questions. I know we had one just pop in. And the question was, is there a limited period of time you can stay on BioTE?
Per BioTE, there is no limited time, really. Again, it comes down to, I've had people who've been with me since we've, starting. So, some are in their 60s or 70s. There is no age limit. The thing is, are you still getting the benefits, from it? We don't have you on any long-term plans. We just want to know, is it working for you? Does it help you, or it doesn't? And
Correct.
We let you decide what you want to do. If there are other things, again, I don't want to make any judgments for anything, but maybe some of the benefits as you get older, maybe weight loss isn't a big issue for you. again, I know I don't want to enter a can of worms, but perhaps, maybe sexual desire isn't a big issue for some. I'm not saying it is for everybody, but I know it is a strong component. Maybe that isn't a benefit from you, but really there is no age limit. If you're getting benefit from not, that's really what I want for my patients.
Perfect. Thank you. Next one is, how long do the pellets last? I think you covered that, but let's go there again.
I think we covered that. Again, generally, it takes between 1 to 3 weeks before they actually start to feel it. I did have one patient who said she got better as soon as I got off the table, but I do think she had a mimosa that morning. So I'm going to have to get back to you on that. But in general, it's 1 to 3 weeks. If they don't feel anything by 4 weeks, they need to come back to see. It can happen. I would say 95, 96% of the time, based upon your blood work, we're able to get the accurate dosage. But, things can happen just as in life. But in general, most of our patients are feeling great. For women, its average is around 4 months, maybe 3.5, 4.5 for some. For men, 4 to 6. I say 5 months for men on there. And they definitely know when their pellets are ending. It's not like a gradual stop, but it's a diminishing. They might get a little bit more irritable. I won't say what I know. My wife knows that the pellets. I mean, she knows from me as well when the pellets are kind of wearing off. But I think I answered your question there. Yeah.
And you answered the next question right there too, doctor. Thank you very much. The next question was, how do I know when the pellets wear off?
You'll know,
You'll know.
Like I know, or somebody else will tell you. But there are some. We're kind of joking about it. But there are some things. These are. I'm not making light of some of these symptoms, but you'll find out. You might find out again. Some irritability might be the first one. It could be some memory issues. Sexual desire may not be as strong as it once was. Those are some clues into the fact that it might be time to get repelleted again. Absolutely.
Okay. The next question is, doctor, I'm already on a bioidentical cream. How does that work? How does that work if I want to get pellets?
Well, if she is contacting us about a cream, that suggests that maybe she's not getting the benefit from the bioidentical cream. So in that case, we often have this where they're using a cream. May not be effective, or they may get some effectiveness, but again, as I mentioned in the talk, is it goes ups and downs. And like I said, with the pellets, it's set and forget. We do keep that in mind with the cream. Oftentimes what it is we take your blood work without the cream so we can truly know what it is without the benefit from the cream. And then based upon that, if you decide to move forward, we can switch you straight over to pellets. There may be some times where, just make sure that you are covered, that there may be some overlap where you may use the cream when we're doing the pellets, or a few days here. But after that, you probably don't need to use it again. And I think for most of my patients, they found out that making the switch, had made all the difference.
Great, thank you. Next question is, are there any side effects?
Yeah, there's always, the side effects are negligible. So things that we talk about, from most of the side effects relate to actually doing a procedure, as any type of side effects as you would get it from a procedure. So what could that be? You could have an infection, from the procedure. Bear in mind, we do everything we can to prevent this. We use sterile precautions, obviously. But there are some things that we ask the patients to do as well. We said about not swimming, you could take a bath. I mean, you could take a shower, but you can't take baths. We don't want you sitting in it, in the area to be wet for a prolonged period of time. There's also could be a side effect that, God forbid, that one of the pellets could come out. It can happen. We had one patient who I mentioned that, we don't want you doing anything strenuous with the legs for the next 3 days for women, for men for 7 days. So no bicycling, no running. You can do walking. For exercise, if you do weights, just do upper body. But we don't want you doing any, splits or lunges or anything like that. But I had one patient who was a yoga teacher, and she decided to do the class the next day. And I just require a steri strip or a strong bandage to approximate the edges so it closes that little incision I made. I don't have to put in a stitch. But, the next day she did it, and unfortunately the pellet came out. And that can happen. So those are probably the biggest things. There are some things, those are the biggest, quote, side effects, that we know of.
I have 2 more questions, Doc, and then we'll wrap this up, okay? Sorry, here we go.
Sure.
This is from a female, do I need to take other medication while on these pellets?
We do recommend supplements. The one that I significantly make mandatory, and actually I'm explaining two now, is the DIM, because that just helps you. It helps with the absorption of your hormone. It's going to balance out your estrogen. It's going to make the pellets, in my opinion, last longer taking it. It can minimize some of the symptoms. Some I've had where, hey, I feel like the pellets weren't as working as long as they could have. And oftentimes they find out it's because they're not taking their DIM. They don't need to get another procedure. They just need to take a little bit more of their DIM. So I make that mandatory for all. Second one that I make mandatory is AD and K, because it's such a inexpensive way of making sure we're optimizing everything we can with the hormones, improving bone health, improving brain health. It just makes sense. We can talk about the probiotics. We can talk about methyl factors. That also plays a stronger component. But in terms of, quote, medications that I'm giving you, there's really no prescribed medications that I'm having you take. Now, if we find that things like your thyroid is abnormal, that might be a case where we want to take some desiccated thyroid.
Okay, great. Thank you very much. Okay, a question just came in. I just recently had endometrial cancer of the uterus, and I'm 69 years old, and my hot flashes are out of control, as well as sleeping all night. Would you recommend this for me since I'm 69 years old? And then, by the way, I had a complete hysterectomy and the cancer only went halfway through the uterus, so I don't need radiation or chemo.
Yeah, that was going to be my next question. I assumed they would have some type of hysterectomy. It's difficult on these times when we're doing a webinar, so I can't say yes or no. I can say it's worth having a discussion about. Mm-hmm. And I have had patients who have had a similar situation that had it perfectly fine. But something personal like that, it's something where I would probably want to get some more information. Again, I'm not trying to dissuade you, but I think I'm not closing the door for you not to have it. I think, as long as the cancer has been in remission, there has been no signs of it, those are the kinds of things that would lead me to believe that you could be a candidate. So I'm not saying no to it, but I'm also not saying yes to it, just because it is a personal situation and I just had to get more information. So I think the next thing would be a consultation with us. So I hope that may not be the answer you're looking for, but I can say that it's something that I'm not closing the door on it.
Okay, thank you very much, Doctor.
Yeah.
So that actually leads into the next point. I just wanted to close up and just kind of do a next steps call to action for us all. Dr. Mike, you shared so much great information with us, and just thank you so much for that and just sharing your knowledge. But, some of us may want to explore hormones because you're very symptomatic, and you say, hey, that's me. That was my story, guys. I'll spare you my story. But, I looked at that, the symptoms list that we went over, and I stopped about four checks into it, and I thought it was a joke. I thought somebody was playing a joke on me. I was like, really? This is for me. But it's honestly like what Dr. Mike said, it's changed my life. We've talked exclusively about that. So, but again, some of you tonight may want to just do the nutraceuticals to boost your immunity, as we said. And again, I highly recommend that. And maybe you want to do all of it. Regardless of it, Dr. Mike and his entire staff with Melissa or Jennifer, as your provider, guys, you have one of the absolute best in San Diego, if not the best. I have to say that because I work with a couple different clinics. So sorry, Mike, it is the best, but I have to be careful. So, but guys, plan, please schedule something with him and get in there to see him, because like I said, his approach is just lights out, and he's here for you. And again, with that, guys, I just want to say thank you so much for your time. And again, please stay safe and be well. And don't be afraid to reach out to either one of us if you have any questions moving forward.
Yeah, just to let you guys know too, I don't know if we have the phone number. If you want to reach out to us, our phone number is, I don't know if we can put it on the screen, 760-290-3552. Schedule an appointment. If this sounds like something that you might be interested in, let's have a discussion, see what's going on. I want to be doing this. I'm doing this because, it's helped my life personally, and that's why I'm just a big proponent, big advocate for it. You know, I've had family members on it, you know, friends on it, and it keeps growing. And if it's something that, if you feel that you're struggling with some of the symptoms that we are talking about, you don't have to struggle alone. This might be a therapy that might be beneficial for you.
Correct. Thank you so much, Dr. Mike.
Thank you, Kevin. Thanks, everybody.
Okay. All right, guys. Have a great rest of your day, okay?
Stay safe.